All right, welcome to The Explainer. So, you've probably noticed that telehealth in Brazil has just exploded in the last few years. It's completely changed how millions of us get healthcare. But, behind that easy, convenient video call with your doctor, there's this incredibly complex maze of rules and power struggles. Today, we're going to dive in and untangle that maze to figure out who's really in charge here.
Okay, let's just jump right in with a number that'll kind of blow you away. In the very early days of this boom, just one single health insurance provider, a mill, did 380,000 remote consultations. I mean, this wasn't some slow and steady thing. It was a full-on revolution, practically overnight. And, it's not hard to see why this took off, right? The promise was just too good to pass up. You had platforms like Medico24HS offering you instant access to doctors, pediatricians, psychologists, you name it, all from your couch. It's literally health at your fingertips. You get to skip the whole travel nightmare, the waiting rooms, all of it. Now, you might think this is just a thing for private insurance, but nope. This digital wave has hit the public sector hard too. Both the government and medical authorities, like the CFM, have been watching over a system where the Public Health Service, the SUS, has delivered a whopping 4.6 million teleattendances since early 2023. That's bringing care to pretty much every corner of the country. So all of this huge nationwide shift, it brings up a really, really important question. Think about it. When you're on that call with your doctor, who decided the rules of the game? Who's the one writing the playbook for this whole digital health revolution? Well, the answer? It's a lot more complicated than you think. Okay, so that leads us right to the heart of the matter, this battle for control over who gets to write the rules. So you've got two major players in this arena. In one corner, you have the federal government, which, can pass these big, broad laws that make telehealth legal for the whole country. And in the other corner, you have these really powerful professional councils, the groups that decide the specific ethics and practices for doctors, nurses, psychologists, and so on. And yeah, they don't always see eye to eye, not by a long shot. And look, you can't talk about this without talking about the Federal Council of Medicine, or the CFM. This is the public body that regulates the entire medical profession, and they have been right in the thick of this whole telehealth debate, trying to set the standard for how doctors should practice online. And wow, this timeline, it really tells a story, doesn't it? It's been a 20-year tug of war. The CFM first tried to do this way back in 2002. Then in 2018, they tried a much bigger update, but the pushback from doctors themselves was so intense they had to pull it back. It literally took a global pandemic in 2020 for the government to just force the issue with a temporary law before the CFM could finally get its current definitive rules on the books in 2022. Right, but here's the catch. The CFM, they only make rules for doctors. And that's how we ended up with this patchwork quilt of regulations. We have one healthcare system, but a whole bunch of different rule books for different professionals practicing online. Okay, so let's look at nursing. The Federal Council of Nursing, COFIN, has its own set of rules for what they call teleinformasm. They have their own rule book, and it spells out exactly what nurses, nursing technicians, and assistants can and can't do online, all based on what their specific job allows. Now, over in psychology, things just got a major shakeup. For a while, psychologists had to be on this special list to practice online. But as of August 2024, that's gone. The Federal Council of Psychology has basically said, hey, it's up to you, the psychologist, to use your professional judgment and decide if going digital is the right move for your patient. And what about pharmacy? Well, they've got their own take too. The Federal Council of Pharmacy is all for telefarmacia, letting pharmacists give clinical advice over a call. But, and this is a big but, they draw a very clear line in the sand. The actual dispensing of medicine, that can't be done remotely. That critical step has to be in person, period. Okay, so with all these different rules flying around, what does it all mean for you, the patient? Let's get into what you really need to know, the rules and rights that actually impact your care. Good news if you have a private health plan. Things are about to get way more transparent. Starting in July 2025, new rules from the national regulator, ANS, are giving you more power. First off, anytime you make a request, they have to give you a protocol number. No excuses. You also get the right to track your request online. Plus, they have to give you a clear yes or no in 5 to 10 business days. And if it's a no, they have to tell you why, in writing, automatically. Now, when we're talking about your doctor, the Federal Council of Medicine's position couldn't be clearer. Their 2022 resolution says it all. The in-person medical consultation remains the gold standard. Basically, they see technology as a great tool, a helper, but not the main event. And these rules from the CFM, They directly affect how you get care. For instance, your first visit with a doctor can be online, but there should be a plan for an in-person follow-up. Got a chronic condition? You've got to see your doctor face-to-face at least once every 180 days. And here's a big one. Your doctor always has the right to say, nope, we need to do this in person if they think it's safer for you. And of course, they have to protect your data by law. So when you step back and look at this whole patchwork system, it raises a massive question. As digital health just keeps growing and changing, is there a better way to manage its future in Brazil? Well, some experts are pointing to this idea called corporate governance. Now, usually that's for a company, right? But imagine taking that idea and applying it to the entire healthcare system. The goal would be to create one single system to guide and watch over digital health, getting every single stakeholder on the same page, all working towards the common good. And man, when you look at who needs to be involved, you really get why this is such a huge challenge. A real governance model means getting all these groups at the same table. The public SUS, the private plans, the hospitals, the tech startups, university researchers, drug companies, and of course, the most important piece of the puzzle, patients. All of them trying to build one single cohesive strategy. Which brings us to our final big picture question. Can a system this fragmented, this messy, ever really work for us, the patients? Can it give us the safety and clarity we need? Or is the only real solution a single, unified rulebook for everyone to finally untangle this telehealth minis for good? That's the question that regulators and, frankly, all of us are gonna have to answer.